how do you define empathy in the context of lean transformational?
I think first defining empathy, it's really, seeing the world through someone else's eyes. And in healthcare, that's really especially important because we're often seeing patients and people on sometimes the worst day of their life. When we talk about empathy in lean transformation in healthcare, it's not just about being nice. It's not just about, understanding what they're feeling. It's also about being curious, present, building trust.
Hello, and welcome to the Lean Solutions podcast, where I am the only host today. I'm very excited, however, to be here with you. We have a great guest coming on. But as we get started, I want you to think about something here. When you think about healthcare, what comes to mind? For some, it might be insurance, it might be Medicare. For others, it might be procedures that you've gone through. For some of us, it might be what you remember about the last time you were there in the clinic or in the hospital or whatever. You might remember the order. You might remember the process that you went through to go through it. What a lot of us that are not in the healthcare field, though, fail to see is some of the, what could you say, firefighting, some of the way healthcare is constantly responding to emergencies, because that's what it's about. Managing shortages, working on the different schedules, trying to do more with less. And the great thing about this environment is that lean methodology promises relief, right? You can think of standard processes, you can think of reducing waste, improving efficiency. But what can be too easily missed when it comes to lean in healthcare is that you can have the best methodology and tools in mind in the whole world, in fact, but if you don't address the human element, the fears, the fatigue, the feeling of being overwhelmed, your transformation efforts are going to hit a wall. Well, today I'm talking with Lindsay Shababy about an important piece that can make or break your lean initiatives. And this is leading with empathy while still driving accountability and results that healthcare desperately needs. So Lindsay is founder of the Summit Performance Solutions, a consulting firm that helps healthcare leaders build sustainable systems and cultures of improvement without adding more to their already overburdened teams. With over a decade of experience in healthcare and operations and a background in military, Lindsay brings practical, disciplined approaches to solving reoccurring challenges in complex clinical environments. A master Lean Six Sigma black belt and a master of health administration, Lindsay has led initiatives across hospitals, specialty clinics, and system-level functions, driving over $15 million in measurable impact. Now, her mission is to make lean and continuous improvement simple and approachable for healthcare professionals who don't have time for the complex tools, the confusing terminology, or the disconnected frameworks. Lindsay specializes in operational stability, daily management systems, and leadership development, where she helps healthcare teams get out of constant firefighting and build a foundation for long-term performance and patient care excellence. Whew, that was a lot to read.
It's a mouthful.
Lindsay, thank you so much for joining me here today.
Yes, thank you so much for having me, Shane. I'm excited to be here.
So I want to know, how did you get started with all of this? Like, you're merging two complementary but interestingly different things, continuous improvement and healthcare. What started first, getting in continuous improvement or in healthcare?
Good question. So I was in the Army for about 8 years. And so I think it started more as continuous improvement.
Okay.
Being in the military, we all know the government is known for efficiency. So, we would do certain things or we would, be in certain places. And in my brain, it was always, there's got to be a better way to do this, or
Sure.
why are we doing it this way?
Right.
Why are we showing up to draw our weapons at 4 a.m. when we're not getting to the range at until 9. It's what is the process behind us, or the thought process. And so that really kind of sparked my interest in continuous improvement in the first place. And once I transitioned out of the military, I got into healthcare, and I had really that same mindset, I guess,
Okay.
of, there's got to be a better way to do this. How can we make things easier for ourselves, better for the patients? And so I started in healthcare at a community hospital that really wanted to improve their stroke and STEMI
Okay.
times. They were looking to get their Joint Commission certification as a primary stroke center. But the issue was that they were really starting at the bottom.
Okay.
They didn't have a lot to go on. And so we had to build out a lot of those systems. And that really ignited my passion for healthcare, or for continuous improvement in healthcare. Really, how can we make the care that we're giving our patients the best we can,
Right.
without using a lot of resources. Healthcare, there's a lot of nonprofit healthcare organizations out there, and so it's how can we give the best care while maintaining operational efficiency,
Mhm.
financial efficiency, so we
Right.
can put our resources back into continuing to develop in that aspect.
Right. Awesome. Awesome. Was this a kind of a long transition, or did you just jump right into, after the military, you just jumped right into it and found, hey, this is my sweet spot, fantastic, here we go.
Good question. Yeah, because it is they're kind of on opposite ends of the spectrum, a little bit. And
It
so,
could be said a little bit.
well, I've always actually been interested in healthcare. The military,
Okay.
obviously took a little bit of a turn in that aspect. But I wanted to come back to healthcare. I've always loved it. I've always had a passion for it. And once I got in it, that was really the trajectory that I took. And so worked
Right.
through, in a bunch of different healthcare systems, saw a lot of different operational environments. I did clinic management, operations management, and then eventually got into the PI department very specifically, and rose to be a leader in that department, which was fantastic. So.
Awesome. Awesome. So in working with this, I guess you could say high pressure. It's kind of a high pressure environment. Like, there's a
Sure.
lot going on at sometimes literally life or death.
Yes, yes.
And working with this, and you mentioned words like efficiency, whether it be financial, business, quality, and how you're serving, your patients and those kind of things. How do you, the topic about today isn't just about, hey, what are the tools you're using in healthcare, but most importantly, the topic is couched in this idea of empathy. How do you define empathy in the context of lean transformation? What does empathy look like for you, Lindsay?
Absolutely. So, I think first defining empathy, it's really, seeing the world through someone else's eyes, really understanding their day, their stresses, their reality. And in healthcare, that's really especially important because we're often seeing patients, and people on sometimes the worst day of their life, especially, if they
Right.
have some sort of acute thing that has happened to them. But we've also got teams that are taking care of them that are dealing with chronic burnout, shifting priorities, and often systems that seem to be working against them.
Oh,
So when we
okay.
talk about empathy in lean transformation in healthcare, it's not just about being nice. It's not just about, understanding what they're feeling. It's also about being curious, present, building trust.
Right.
Yeah.
I really like that. I'm writing that down. That it's more than nice. I think you mentioned. I thought I heard the word building trust. and understanding where people are. And I think you started that very interestingly in that, part of it is trying to get into the mindset. What are people experiencing? And I have to think, Lindsay, there could be two things. You're wanting to know, hey, what's the client, what's the patient, those that we're serving, what is their experience? What is their day like? What is their journey? But also, from the PI perspective, I would imagine that you're also looking at the healthcare workers and trying to, and you mentioned, systems that seem like they're working against you, and those kind of things. Is it a fairly easy balance to keep both of those in mind, or is that something that you have to walk a fine line when you're working with teams to try to balance, hey, we want the best experience and having empathy for the patients and clients, but also, those that do the work, we want to. So how do you is that even an issue, balancing that?
I think it is, yes. And that is a great question. It's a tricky balance, as we have to do what's best for our patients, but sometimes that means that for our staff, they have to do things that may not necessarily they want to do.
Sure.
But it's for the good of the patient. Because in healthcare,
Right.
that is our main goal, is to take care of our patients, right?
Right.
So the question then becomes, how do we best take care of the people that are taking care of our patients, right?
Oh, right.
If we take care of the people that are taking care of them, then as a whole, if we take a step back and look at it, big picture, that really improves a lot of aspects of healthcare.
Right. Okay. I can see that. And as I'm thinking about this, when we're talking about defining empathy, in the training that I got with Lean Six Sigma, working for the state of Nebraska, we also tried to define empathy and the difference between empathy and sympathy, and trying to get our
Sure.
um, what we called process improvement coordinators, all the PI people that were scattered, embedded in the different agencies, to see the difference. Because sympathy says, "Oh, Lindsay, that's really too bad that you weren't able to do that. I'm sorry that happened." We just leave it like that. But the idea of empathy is wanting to understand, like you were mentioning, leaning in with curiosity, but not just leaving you there. And that was the big challenge that we tried to get, when I would do training for our green belts, to get them to understand is, hey, don't just saddle up next to Lindsay and tell her how you really understand what she's going through, but then ask questions to help move into what some of the solutions might be. So we're not just leaving you there, sympathetically. Oh, that's too bad that's happened. I could see why you could be frustrated. Um, but okay, so how do we move over that? So when let's talk about overcoming the resistance, because people, I've heard it said that people don't mind change, they just don't like it done to them. Right. So
Right. Yeah,
how do you
exactly.
how do you were talking about taking care of the people that take care of the patients.
Yes.
How can you give, like, share a time when were able to lead with empathy that made a direct impact with a group that would typically be resistant to
Yeah.
some of the changes?
Yeah, absolutely. So first I want to say that, kind of going back to your point, like sympathy versus empathy, empathy in lean isn't about being soft. Um,
Right.
and it's really about truly understanding the daily realities of the frontline teams. And so, uh, when we do things like go to Gemba, we're really going there to understand those complexities. But it's also to create relationships, trusting relationships, because I
Right.
think that ties into that resistance that we find. And so building that initial foundational relationship is kind of the first step to overcoming some of that resistance to change. When it's coming from someone that they trust and they've seen that trust in action, it's a lot
Right.
easier to convey some of the changes that might be necessary going forward. Um, but to recall on maybe a time of overcoming resistance. So I was working on a project with a healthcare team, and our goal was to improve patient flow
Okay.
from the ED to the floor. There's a lot that goes on in that process,
Okay.
between, from communication to making sure, to logistics to who is doing what, and making sure that each team has the information they need.
Right.
So it's a small process, but when we kind of dive down into it, it definitely becomes a lot more complex because each patient is different. And that's, one of the interesting things about implementing lean in healthcare is there is a lot more variability than, say, something
For
like
sure.
manufacturing. So we have to account for that. But with
Yeah.
that project, it was very nurse driven. There was a lot of hesitation. They had tried a couple times before to do this project over and over again. And so there was a lot of doubt that,
Ah,
oh, we've tried this before. What's going to be different this
right.
time?
Right.
So instead of, leading with the data of, well, it's taking this long to transport a patient from the ED to the floor, um, it was more in the beginning of really just observing, sitting in on a few shifts, listening
Okay.
to what was actually happening, asking questions of what's getting in your way. What are the challenges or some of the barriers that you are encountering when you go to take a patient from the ED to the floor. And so what we discovered that way is it wasn't, necessarily a competence gap or a training gap or anything like that. There was just a lot of broken communication during the handoffs. There was no
Sure.
loop to once the patient got on the floor. There was no way for the floor nurses to contact the ED nurses to say, hey, I'm missing these pieces of information that I need to continue care. And so we learned a lot in that aspect just by listening rather than here's what the data says, let's fix it, taking a very
Yeah.
objective approach to it. Um, and so I think that went a long way because, I listened first and they saw me more as a partner there to work with them
Mhm.
and not necessarily as a disruptor. Oh, hey, I'm from PI. I'm here to completely change
Mess
all your
everything up. Right.
processes and mess everything up for you. Exactly. So it was really, we co-designed a solution together,
Okay.
rather than
Awesome.
me telling them what to do. And I think that small shift really, chipped away at a lot of that
Right.
change resistance.
Okay. So let me ask a question for those that are hearing this and are like, hey, that's not a bad idea. You basically what you mentioned is kind of going to the Gemba, go to where the
Mhm.
work happens,
Yep.
and just plant yourself and pay attention and ask. For those that are interested in this idea, how many people roughly would you say that you are able to connect with, and about how long did this take? Was this something that you just did in one sitting, a half hour, and you thought you had it, or did you have multiple sittings? Like, let's just talk about the logistics of this, what this looks like in the real, in this
Yeah.
example. It
Yeah,
because you mentioned
sure.
could be variable. There's a lot of variations. So
Yeah. Absolutely. So like anything, it does take time. You can't build a relationship overnight or in, half hour observing, right?
right,
Because when you walk in, staff they're going to be a little bit wary of, why are you here? Why are you observing? What are you doing?
That's right.
Like,
Yeah.
especially in the healthcare environment, you find teams that are very tight knit. And so when everybody else is in scrubs and you're walking in business casual, they're like, oh, someone from administration is
That's
here.
right.
Oh,
With
we're
a
in
clipboard.
trouble. Oh,
Oh
yeah,
boy, here we
exactly.
go.
Yes, exactly. So it's really just getting in. I mean, it took me several days,
Okay,
and
sure.
one, that was part of that was really just wanting to observe some of that variation, because you
Okay.
can't go in and see the same process over and over and over again in like an hour time span. Each patient is different, so you want to make sure that you're capturing as much variation as possible.
What
Um,
are some of the questions that you would ask yourself doing this? Like just for someone to think about.
sure. So one of I guess the question, or I guess my mind, it was more of starting to walk through the steps of observing, okay, they have a patient over there. How are they first calling for someone to take the patient to the floor? What
Okay.
are they inputting into the patient's chart? From there, what are the things that the patient needs to take with them? Do they need monitors? Do they need, any devices that are going
Sure.
with them? How do they annotate that into the system? And how do they convey that to the floor nurses? Do they have a phone call? Do they do it over secure chat? Do they, so it's some of those small logistics that are running through my mind of, why are they doing what they do? And that's the nice part about really what I do, is I can walk into a healthcare organization and be those outside
Right.
eyes. And
Yeah.
I can ask, I mean, I'm not clinical. So I've learned a lot over my years, but at the same time, I'm still not clinical. So I kind of have this ability to ask, quote unquote, the dumb questions
Right.
of, but they're very insightful, because if you ask someone who does this on a, day in and day out to explain their process, sometimes they can be like, well, we do this. And I'm like, why do you do that? Well, I actually don't really know. Somebody just taught me how to
Yeah,
do it, and
exactly.
that's
Yeah.
how I've been doing it ever since. So
Right. Right.
that's the way we've always done it, right? The
Right.
the key phrase there. So
Yeah. So in doing this, you're asking questions, you're thinking curiously about things. Um, as you're moving through this, we talked at the very beginning. I talked about kind of the human side of things, the feelings and the fears, and some of that. How do you ensure that that isn't left behind? Because you're trying to collect more than just data. You mentioned you're trying to build trust, but as you go through, how do we make sure that we still hold on to that these are human beings, whether they be the clients or whether they be the people that are taking care of the patients and serving them?
yeah, great question. So I think we need to start by recognizing that fear of change is normal. That humans don't typically like change. We like our processes, we like our routines, and
Right. Yep.
especially in systems where people have burned out or feel like they've been burned before by failed initiatives of, we've tried this over and over again, that this,
Right. Yeah.
what's different about this time. But I think it's always pairing the tools with intentional conversations too. What does
Oh,
this
okay.
change mean for your day? What worries you about it? Here's how it could potentially help you. Using the tools not to guide the projects or guide the initiatives, but using them really just as a supplement to kind of add to.
Interesting. Okay. Yeah.
Yeah. So, but I think, using things like huddles and visual management too, not just for metrics, but for connecting and for recognition, and for having some of those feedback loops. I think they all contribute to this idea of building psychological safety in healthcare. When we build that psychological safety, that's when people feel like they can convey their
Really.
ideas and their thoughts and maybe some of their concerns without repercussions, and that they'll actually be heard.
So let's talk about the other unique balance that you have to have in working in with continuous improvement, and that is the balance between modeling empathy and wanting to communicate understanding and curiosity and those kind of things with driving accountability and results. You
Yeah.
kind of you have to have both of those, right?
Yeah.
Especially in a hospital, you got to help these people. It's not a question of, well, I guess we could not do it. So how do you see leadership? What would be some things you would suggest to leadership in regards to modeling empathy, while still holding accountability, holding true to accountability
Sure.
and results?
So I think one big thing that has been, I guess, powerful or influential in the work that I've done in healthcare is taking the metrics or taking, our outcomes and tying them back to patient stories of,
Oh, I like this.
whether it's good or it's bad.
Yeah.
I think that has been something that healthcare people in healthcare can really latch onto, because by nature, people in healthcare are very empathetic. They're very, um, I mean, they're givers. They help people. It's just their nature. And so when we can tie, oh, we had a patient fall, or our outcomes aren't doing great. Sure, we can have it just as a number, but if we can say, our outcomes have um, decreased, and this is what it means for our patients. This is what it looks like in real life.
Mm-hmm.
I think that's easier to digest and really kind of builds the burning platform a
Right.
little bit
Yeah.
stronger, in that we need to do something. We need to change, because over time, if we start to get worse in this outcome, this is what it means for our patients. And not only
Right.
that, this is what it means for our hospital. Um, and so I think that's very powerful. But in terms of leadership, continuous improvement starts at the top. And so leadership sets the tone, right?
Sure.
You can't delegate culture. You have to build that from the top. So so
I'm going to
when
write that down.
so when leaders they're visible, they're vulnerable, they're curious, and not just outcome focused, I think that's when they really create that space for honest dialogue and faster learning. Empathy and accountability, they don't have to be opposites, right? I
Agreed.
think
Yeah.
that they can have a balance. They can coexist. Um, I mean, some of the best leaders I've worked with, their questions have been, what barriers are getting in your way, and how can I help remove them? I think that simple question really shows that empathetic side, but it also has, you know, I want to make things better for you so we can get better outcomes as well.
So I'm curious if in thinking about kind of the empathy, understanding what people have to go through, but also kind of the accountability and wanting things. You mentioned before about having taking the things you're measuring, the metrics you're having. Is there a time that you can think of a situation where the empathy came in with and we've kind of touched on this just a little bit. The empathy comes in with understanding these people are already overworked.
Mhm.
The caregivers, that are serving our clients are already overworked. So is there a time when it's that you have found that it's okay to let go of something temporarily, maybe, so that you could pick something else up because we need to do this one thing to move forward? Is that making sense? Because there,
I think so.
the empathy being, I see that Lindsay's plate's already full. I have more things for Lindsay to do. So my empathy comes in and says, okay, with accountability, we need to do this, but I can remove this off of Lindsay's plate so that she can then take this. Can you think of
Sure.
situations, stories, and how did you go about that? If you can think of one specifically.
Sure. So the thing with healthcare is, it's always going 24/7. It
Yeah.
doesn't stop. We can't shut machines down. We can't, take the day off. We can't do any of that. There's always patients. There's always people to take care of. And so one of the challenges with, I think, implementing lean and continuous improvement in healthcare is really finding the time. You know, many projects I've worked on, we have had to take 12-hour projects and distill them into a 4-hour time block. We've had to take longer projects and chunk them up into like 1 hour working
Sure.
increments. And that's just the reality of it. And so I think it's understanding, knowing from kind of the C-suite perspective, this is what needs to be done. And these are our goals, and these are the outcomes we want to see. Balancing that with, well, our floor nurses are burned out. They don't have time for improvement work. We're already short staffed. And so finding kind of the balance in between the two, creating a realistic timeline that we can convey to the executives, taking into account some of the time constraints from the front line.
Do you find, just just a quick interruption,
Yeah.
when it comes to the C-suite, how easy is it for them to accept that timeline? Like I got this. You mentioned this is a fast moving thing. Like it's always
Yes.
moving. I want results now.
Yes.
How easy is it to convey that?
I mean, in my years, I've learned really just how to have those conversations with both sides. And I think it would honestly depend on the project or the outcomes that they're looking for, how urgent they are.
Sure.
Because I've had projects where the timelines were a little longer because there wasn't as high of, let's say, a safety risk or a quality risk. But I've also had projects of, hey, this keeps happening and it is a huge safety concern to our staff, to our patients. We need to do this right now. And so if we have the latter type of project, it's really talking to the C-suite, talking to the executive, saying, hey, I know your staff is, overworked right now and they don't have a lot of time. What are some things we can do to create that time for them so we can tackle this project? And it's, hey, let's do this all in one afternoon. We don't have to pull them off the floor multiple times, or we can get this done in 2 weeks. We'll do 2 hours here, 2 hours there. So I think it's really just a back and forth and just understanding the balance and the goals of both.
Okay. Yeah, that makes sense. Which I would say that's being empathetic, because you need to understand. And holding accountability, we do need results.
Absolutely.
So
yes.
as I am one who is insanely addicted to the practical, you could say. Like,
sure.
I really want, let's just not take these ideas. Tell me what this looks like. Show me what this looks like. So for the last question that I have, let's talk about those that maybe, let's put this in the context of, hey, there is someone new or they are new to being in a CI role in a healthcare, in the healthcare industry. What are some practical things, some first steps, some principles, anything like that you can share with them, you've already mentioned, having empathy, working with leadership and trying to prioritize, but, those kind of things, what are, and maybe even more detailed, I don't know, however you
Sure.
do it. But if I was brand new, give me, a 30 to 60 second here. You should probably pay attention to these things.
Sure. So I think first and foremost, if you are new to a CI role in healthcare, just go in and observe, learn your way around the healthcare system, learn who the key players are, learn, how some of those departments operate, and just do some observations. Go to Gemba, talk to people, see what some of their frustrations are. So maybe you can pull out, one or two really great initial projects to work on.
Sure.
And then I think, something else is start small. You don't have to tackle an entire hospital project all at once. Start with a department, start with a team. Three, I think, try and make the data as personal as possible. I talked about it before, tying it back to patient stories or frontline experiences. I think another good one is to make sure that we're celebrating progress, not just outcomes. If you're in a project, make sure you're celebrating even the smallest win, because that really keeps people going. So at the end of the day, you can move fast and be compassionate and empathetic. One builds momentum and the other builds trust. And together, those two are really powerful.
Awesome. Well, Lindsay, I really appreciate all of this. I appreciate your passion for the field, for what you do. Very excited. If people were to want to follow you, want to learn a little bit more and, kind of glean from your experiences, where could they find you?
Yeah, they can find me on LinkedIn. I post a lot of great content on LinkedIn. I've also created a really great hub for healthcare improvement called Project Elevate. Yes,
I love
yes.
that.
So
Do we
my
have that
goal,
information? Have you sent that to us? Because we'll put it in the
I'll
show
send
notes.
it. Yeah, I'll send it
Okay.
over. But it's a really great platform. I post weekly tools, case studies. It's a good community for people who are really passionate about improvement in healthcare to come together, to ask questions, to share stories and things like that.
Awesome.
So yeah.
Okay. Excellent. Well, thank you so much again. We'll put some of this stuff in the show notes.
Awesome.
And for those of you that have been listening, thanks again. We hope you have a great day, and we'll talk to you later.
Sounds good. Thank you, Shane, so much for having me.
Thank you, Lindsay. Bye for now.
Bye.